It is Wednesday, April 15th. Watquanuradu Zowego. Joe Delaron Ujets. Welcome to our daily COVID-19 task force update. We have a full lineup today. There are a few developments, some of them very interesting, and I think Lloyd Phillips, our Commissioner of Public Safety, will lead things off with some news. Lloyd?
Good evening, everybody. Welcome to another edition of Facebook Live and COVID Task Force updates. It's been a long week thus far. A lot of information that the task force has been assessing, and we just finished just a little while ago a full update, a full meeting with the full task force, and we went over a few of the items that I spoke of yesterday, and update on those, and also on a couple of other topics. But first of all, I just wanted to touch on a few things. Watching again the news and the media, throughout Canada, and they're talking about that whole flattening the curve, and the fact that it seems to be working. That what's going on throughout Canada, what's going on throughout Quebec, and certainly what's going on in Kahnawake is working. The projections and the numbers are at the lower end of the spectrum. Even though unfortunately the death rate keeps rising, but it's still under some of the projections. So now is certainly not the time for any measures to be reduced or removed. That we have to keep our foot on that gas and keep moving forward on the path that we are on. With that said, I mentioned yesterday about the comments made by Premier Legault, and he created some confusion on when he mentioned about opening up the construction industry and associated with that with some gardening centers and some issues with the mechanics and the garages. So I mean that caused some questions to be raised in the community. Not just by business people, but community at large had many questions. And so we had a good discussion today at the task force, and we came to a conclusion based on everything we've been hearing, based upon the full assessment of the situation, including input from Dr. Gauthier, that we feel at this point in time, regardless of what the Premier Legault has stated, that the directive that construction is for essential repairs only will be maintained. So if previously the directive was clear that for construction, if you have a major problem with your home, a leaking roof, burst pipes, things of that nature, that certainly can be repaired as quickly as possible. But then for the normal construction, that is going to remain on hold until we have a better assessment of where things are going. And what we had agreed to as a task force is we're going to look at this whole area and revisit in 2 weeks from today, and decide based upon the science, based upon the numbers, on what could be reassessed and what areas we may be able to modify various measures. But in the meantime, we have decided to maintain the direction that was previously set by the COVID task force. Along the same lines as that, I did have a discussion today with a member of the Quebec government, MNA, a member of the National Assembly, and we had a good discussion because I relayed the information to her that what comments that are made by the Premier, obviously our people watch the news and such, and they see what they're being said, and some people get the impression whatever Legault says is what's going to happen in Kahnawake, which is not the case. Like I said several times, we assess what's being done out there, and we may or may not follow suit, but depend on what's required in our community. And we also had a good discussion, and not that we're seeking or need anybody's approval, but she reassured me. She says that Kahnawake has absolute full authority to do whatever measures are taken in Kahnawake without interference by outside authorities. Just hearing it from her, again, it just supports what we're doing here. And like I said, we don't need that approval, we don't need that support, but just hearing it from a different angle, obviously is reassuring. And I just want to relay that to the community, because everything you may hear the Premier say, or other Quebec officials or Canadian officials say, does not necessarily apply to Kahnawake. That's why we developed the Kahnawake COVID Task Force under the authority of the Kahnawake Emergency Preparedness Law, and that's the way we're going to continue moving forward for the foreseeable future. With that said, we also will be having a press release going out very shortly that will clearly define the latest measures that I just talked about regarding construction. It also talks a little bit about the landscaping and other areas. But the bottom line, what it comes down to, is that we want to maintain the fact that Kahnawake is for Kahnawake residents only and essential service people. So if you don't have a purpose for being in Kahnawake, obviously if you're a resident, but if you're here working for the community, you're welcome. You're here doing deliveries for essential services, you're welcome. But beyond that, we're asking people to please stay away from our community, because we want to protect our community as best as we possibly can. And at this point in time, the best way to protect your community and protect yourself is to distance yourself as much as possible from people that are not within your immediate family. And we certainly don't want to have people from the outside coming here who we have no idea where they came from, who they are, and so on. So again, it's a matter of protecting our community. But with that said, we also agreed today, and there will be a new directive drafted tomorrow, where we're going to be pulling together the appropriate people, organizational-wise, with maybe Dewa Dunizakta and other entities, to start working with the various business entities in the community, such as construction, such as tobacco and such, on how we can start planning for the eventuality of when we're going to start returning things back to normal. How can we do that in a staged manner? How can we do that in a manner in which makes sense, so that we don't flick that switch off one day, on the next day, and then possibly have the resurgence of the virus in and around the community. So we want to make sure we create that plan moving forward, and we certainly want to have the input of the business community on that. And actually, Frankie McCumber, Council Chief Frankie McCumber, has volunteered to lead that, and I'll be speaking with him tomorrow, and we'll get more details on how we're going to move forward with the directive being issued by the task force to gather that information and create a plan that we can phase back in when things return back to the new state of normal. So with that said, there was several other discussion points, and then we have a number of speakers who will come up here after me to definitely update on their specific sector. And with that said, I just want to end off by saying that again, that we have to maintain the course. We have to keep doing what we're doing, because it is working. I am confident it is working, and if we stay this course for the next few weeks, we will be able to look back at this time in history and say it was one of Kahnawake's finest moments. So we owe it to ourselves, and we owe it to our elders to stay the course. So with that, I'll leave it up to our next speaker, and Onigiwahi.
Yeah, great job there, Lloyd. Lloyd mentioned that a press release will be issued. It will be going out this afternoon. So if you want to take a look at it, it does have some details, which I think are important, especially if you're in that position where you have some emergency work that has to be done. It pretty much makes it pretty clear. So look at kahnawake.com. It'll be out there within the next 90 minutes or so. Coming up next, doing his report, we haven't seen him for a few days. We welcome back Peacekeeper Chief Dwayne Zacharie. Dwayne?
Good afternoon, Kahnawake. It's great to be back. I have a few little bits of information that I'd like to share. One of the things that I want to mention again is thank you very much to all of you who are following the directives. It's vitally important that we all cooperate, right? It helps if everyone cooperates and follows along with the directives, because at the end of the day, we're all in this together. and we want to minimize the risk to each and every one of us, our elders, our youth, everybody, right? Because we don't know how serious this could get. We do know it's here now, right? It's coming. We're still not at the end of it yet. We want to get over that peak, and we want to start to see what's going to happen on the other side, maybe get back to some, form of normal, whatever that's going to be afterwards. But I wanted to make sure that people understood that the Kahnawake Peacekeepers are extremely pleased with the cooperation that we are getting with the vast majority of the community. There are still some people, though, that aren't getting it, and I'm here today to say, like, listen, people, you have to really follow along. Like over the weekend, right, it was Easter weekend, so lots of people had celebrations, some people had family get-togethers. That's a no-no under these situations. You can't have people coming over. I know people say, oh, my immediate family, that sort of thing. It doesn't work that way. People under your own roof, yes. People from other places, not under your roof, do not have them come to your house. You can't do that. That creates an issue for each and every one of us. You put us all at risk. You need to really be aware of that. Like, people call us all the time. We have lots of Facebook posts, right? People are saying, this person is doing that, this other person is having people over. We're out there, we're trying to have a discussion with all of these people. We're trying to educate you. We're trying to make sure that people understand how imperative it is to follow along. You need to follow these rules. It's for your own safety and security. It's for each and every one of us, right? Because this virus spreads like crazy. And I mean, one person who has it, they can infect hundreds of people, more than that. I'm not the expert in this area, but it spreads like wildfire, and it's up to you and us and all of us together to make sure that we follow these rules to try and mitigate this as much as possible. Another piece of information, and I know people are interested in this because we get lots of calls. You've seen the new signs up and around the community. The Peacekeepers have been out there and they've been very diligent about issuing fines, and infractions for people who are contravening the signs. To date, we are just over 60 infractions that have been issued, right? So the fine right now is $1,541 for the ticket. At this moment, no one from Kahnawake has received a fine yet, but I mean, in light of some of the stuff I just said, probably that's coming soon. And I mean, you've been warned numerous times. We're trying to work with you. You need to follow along. In the last few days, I've been in contact with some other policing partners. Canada has invoked the Federal Quarantine Act. So what that is it applies to people who are coming from outside the country into Canada, right? So if you're a traveler and that's what you've done, by law, you're now required to come home and quarantine or self-isolate for 14 days. It's not a suggestion, it's by law, you must do it. If you don't do it, you're subject to fines, and the fines are a maximum of $750,000 and or 6 months in jail. If you don't self-isolate and you're sick and you cause someone else to get sick, the maximum fine is $1 million and 3 years in jail. So these are maximum fines. I don't know how it'll play out. I guess if you fail to comply, you'll find that out in a court process, right? I'm sure nobody wants to do that, but if if you're not interested in heeding advice or warnings, then by all means, let us know how that goes. One of the things, it's vital. Listen, you got to follow along. You got to listen. We're cooperating with other policing partners because it's not just Kahnawake that's facing this pandemic. It's the entire world, right? I mean, you go on the news, you see the channels, every single channel, it's global pandemic, right? So it affects everybody, each and every one of us. We all have a responsibility to be, to follow the rules and to make sure that we can all make sure each and every one of us are safe. So that's it for my message for today. I just wanted people to realize that this is very important, and each and every one of you needs to help us. So we're looking forward to your cooperation. Now.
All right, thank you very much, Dwayne. On yesterday's report, our daily update, if you saw it, we talked at the very end about the emergency measures that have been taking place in terms of financial compensation and how some of the staff and some of the council chiefs and others have been working many, many hours to try and get people some help. And so as we mentioned that yesterday, I'm glad that today joining us on the program is Ietsénhaienhs Gina, and she will give us a little update on how that is going. Gina?
Good afternoon, Kahnawake. Very happy to be here. Before I get into any of the numbers, I just want to thank Dwayne for, giving us that update. I think it's really important. This isn't easy for any of us to do. It's very challenging because it's gone on longer than we had anticipated it would. Most of us really thought we would get a hold on this and it would be over soon. It isn't. It's kind of a long haul. I, as a mother and grandmother, struggle, holidays passed, and you want to see your family, you want to hug your grandchildren. So I have to give thanks to the COVID task force, all the work that's being done here. I think it's really important. I also want to give thanks for this great hand sanitizer. I received mine today, and I think it's such an awesome gesture. People in the community are stepping up in different ways, and this is one of the amazing ways, that people are contributing and helping. I want to also thank the team who has been working throughout the weekend, who've given up, Easter dinner or whatever, to be here and to make the calls necessary to help get the monies out to the people who need it most. There were some comments on social media, and one of the individuals who had, committed her weekend to making these calls got in touch with me, and she said, Gina, I'm a little bit offended. She goes, I'm working tirelessly. My mouth is dry. I've been speaking to so many people. I've been trying to help facilitate these papers and get, these checks out to the people who need it. To see some of the criticism, it was a little bit hard for her to take. And I said I would mention that. And I think it's really important that people understand the amount of work that is being done. Nobody is sitting back and relaxing throughout this. There are people who have continuously been working, who've gone beyond the 12 hours that they've been doing. There are people who are continuously talking on the phone, tell me how dry their mouth is, how tired they are of speaking. And I want to acknowledge them today. And I think it's important that the community acknowledge what's being done and be made aware of what's being done. There is a lot of people at work here beyond the COVID task force. And to anyone who's contributing in a positive way, Kahnawake, I thank you. So today I want to talk a little bit about the money that has gone back into the community. Originally, we had 304 checks that were issued. The second round of checks that were being issued starting tomorrow is 279 people in the amount of $390,000. And for the business side, we have 41 applications that have been processed and approved so far. Of those applications, we have $82,278. So to date on these check runs, we have an amount of just over $900,000 that has been given out. So we're approaching that $1 million mark. As I said, this is going to continue for some time. This is not going to end anytime soon. If we start to go back to any kind of lifting of any sort of restrictions, you heard Lloyd Phillips earlier who told you it'll come in increments. And we have to be very cautious how we do this. So again, a lot of work is being put into, these applications. We have 900 to date. We have people who have actually given us the incorrect number, and we have people who have not answered their phone. We don't always have a Mohawk Council number that will appear. It will say private caller, no name, no ID, such as, because there are people working, from different locations. They're not all working out of the MCK offices. So if you are waiting for a call, please ensure you answer your phone. And if you have not received any sort of call, please call back. The number for individuals to call for an application is 450-638-0500. And at Dewaduni Dakta, 450-638-4280. Stay safe, Kahnawake. Kahnawà.
Yeah, Kahnawà, Gina. And again, so if you're a business owner you contact DEWA. If you're an individual, you contact the client-based services. And joining us for her daily update, the very busy Lisa Westaway of the Zacharie Memorial Hospital Center. Lisa?
Thanks. Good afternoon. I have a few updates today. The first, I wanted to talk about our inpatient, long-term care in particular, because that is the topic. It's been very difficult, I think, for those of you who turn on the news, and maybe you've stopped turning on the news, but what we are seeing is a lot of death every day all over Quebec, Montreal, very close to our places, close to our hearts, just close to our community as well. So I feel that it's very important for me to give you updates on a daily basis to kind of counteract those messages you're seeing, because I'm very conscious of the fact that you are not able to see your loved ones. So I think it's important that you hear of what has been happening. As I mentioned yesterday, we do health checks of our patients on a daily basis, both mental health and physical well-being. And I just wanted to reassure you that we are not seeing decompensation of mental well-being of the patients in inpatient. We do see loneliness. We often have to repeatedly explain to the residents why their family members cannot visit, and we take the time to do that. So I don't want to lie that we're not getting those questions. We do get those questions, and I think it's normal that we get those questions, and we do often get them repeatedly, but we have measures in place to ensure that we're continuously explaining to our elders why they're not getting visits, and we do try to make up for that with the staffing that we have. But again, some of the elements that you're seeing in the news about mistreatment, about decompensation, cognitive loss, we are not seeing those things in our elders because we're putting measures in place to ensure that that does not happen. I wanted to mention as well, yesterday I said that we were going to be putting other measures and safety measures in place, as Legault had mentioned in a couple of days ago in his presentation. And one of those things is to minimize as much as possible the amount of staff who are working in two separate locations. So we've been working hard to analyze that situation over the past couple of days, and we will be losing staff. We'll be losing some RPNs, LPNs, we'll be losing some RNs, and we'll be losing some PABs. I think, as you know them, a PAB is an orderly. So we will be losing some staff. Most of those staff are on availability, and so they did have jobs at other locations. And so this is okay. This is a process that's happening across Quebec. It's a safety process. These people will not be losing their jobs. They will be coming back to work after the pandemic. And we have other people who are going to be adding extra hours to their time because they will be leaving their other location and staying full-time at KMHC. So I just wanted to explain to you that we're going through that process. It is a balance. And the other reason why I'm mentioning it is because you're seeing in the news of the lack of resources, the severe lack of resources in long-term care facilities. So in fact, we are going to notice the impact, especially with respect to our orderlies. And we have different measures that we're going to be implementing in order to try to get more staff. And so it's a balance. It's a balance between safety, between having enough resources, and we are able to meet that balance right now, and we prepare for the future in the case of having to send people home for isolation if there are any positive cases. Again, I reassure you, I do this daily, but I think it's important. We do not have any positive cases at the Elders Lodge, at ILC, nor at KMHC. Just one last thing that I wanted to mention about inpatient. A couple of days ago, I focused a lot. I had received a question from Paul Grafe about why our KMHC may be different, and I had spoken about the fact that many of our employees actually are from Kahnawake, and unfortunately, that may have been misinterpreted by some of my staff to mean that that I wasn't grateful for the staff that aren't from Kahnawake. And I really wanted to correct very openly that misunderstanding, because that wasn't at all the point that I was making. And actually, we are extremely, extremely grateful for all of the staff that we have, all the staff who are considered essential and who have always been essential workers. Again, I really don't like that terminology, but going, all the way from security to reception to finance to administrative agents. So I'm not naming them all, but every single person has a place. Every single person is important. Every single person is essential, and every single person is contributing in their way to this fight. So I think that's really important to mention. I'm going to talk a little bit about the testing site. We do continually get questions about symptoms. So I wanted to just give a bit of information. There was a little bit of research that was done in Montreal for those people who went to Montreal testing sites and who were positive. So they looked at the percentage of those positive people, the percentage of symptoms that they had. So I'm going to give you a little bit of a summary of that compilation of information. First, I just want to highlight the fact that cough and/or fever and/or respiratory symptoms or some breathing issues and/or loss of taste or smell are still the main symptoms that people state having that have been tested as COVID positive. So that does not change. However, there are other symptoms that people also experience. So there could be general weakness, there could be headache, there could be chills. There could be muscle aches, so joint, chest ache. There could be diarrhea. There could be nausea or vomiting, and there could, and I mentioned the others. So these are self-reported symptoms when people come in for their testing and who have become positive. So as you see, the main focus is still the symptoms that we mentioned to you, but those other symptoms could be combined. So if we looked at the percentages of all these symptoms, they don't add up to 100% because many people will have more than one symptom. So I urge you, should you have these symptoms or any combination of these symptoms, that you call the testing site. They are very capable of speaking with you, of analyzing with you whether you should be tested or not. So I urge you to continue to call between 8 and 4 and we will give you an appointment for testing. We talked a little bit about it. Dwayne referred to it, but I feel the necessity to harp on this a little bit more. For those of you who are all following the measures we've implemented, I really congratulate you. I don't want to, sometimes when we continuously harp on the small percentage that are not following, we lose those who are doing so well. So I'm going to start first by complimenting those who are doing an excellent job and who are maintaining all of the directives that we've implemented despite the difficulty that they face every single day. But we are still aware, and it's brought to our attention on a regular basis that many are not following the directives. Many are still trying to travel or are traveling back and forth to the States and back. And to be quite honest, it's totally and completely unacceptable. Under no circumstance should this be allowed. And as Dwayne mentioned, there are measures being implemented to try to stop this as much as possible. But we can't even understand how somebody would even want to put themselves in this position where they have the potential of hurting their loved ones. And so I think it's just important that we state that very clearly. I know we have before, we're stating it again. It is unacceptable to leave Quebec. You should be staying in your home. We have control over this virus. We have control. We can lose control very easily. The way to keep control, the key to our success is social distancing and staying home. I'm going to just end my update today with a quote that I saw, an evening affirmation. It was actually on Facebook from Let's Talk Kahnawake. So what it says is, tonight I release the events of the previous days. I take a deep breath, and I let go of what has passed. I clear my spirit and breathe in new light. This light fills me with warmth and love. I am renewed and fulfilled. Tomorrow I start refreshed. Every day is a new day. Every day we start refreshed, and we must remember that what we're doing is important. What we're doing is saving lives, and we must continue. So thank you for listening.
Very good, Lisa. Just before we leave, just a couple of notes. And, you know, we have a lot of the doom and gloom, of course, because that's our reality. For example, today it was announced that Canada now has over 1,000 people who have passed away from COVID-19. However, you look at some of the good things that are happening. I look at this past weekend, there was an Easter egg hunt, a virtual one where people were driving and looking and reporting later on. Also right now there's a group that is doing beadwork, and they have a kind of a little contest going on. And today, the Kahnawake Waste Management Department announced a modified Kahnawake Spring Cleanup Challenge. So that's going to be going on starting today, as a matter of fact. And it kind of works the way the Eastern Doors cleanup was going, except it's smaller. It's the people in your house. So for example, at my place, it's my wife and I. That's it. If we're going to take a little area, just her and I will bring a garbage bag, fill it up, and then bring it back to our property and leave it for the garbage pickup on Friday. There will be prizes given out. It's kind of a fun thing. You take a picture of the lot where you're cleaning up before and after, and just make sure you register with Waste Management. You can do so at Kahnawake Waste Management Facebook page, at Recycling in Kahnawake. Also, you can do it at wastemanagement@mck.ca. Send your pictures and you could win a prize. So before and after picture, make sure you follow all of the standard procedures such as social distancing and all of that. And it's just a nice thing. Plus, we're cleaning up the town a bit. So that's a good little bit of news. Just a reminder again, Lisa mentioned the appointments. You can call 638-3930. That's Cattery Memorial Hospital Center's number. And the extension is 2296, 2275. And that's where you can get your appointments made. And again, you can make those phone calls starting at 8 a.m. and they open up the testing center at 11. It goes till 4 o'clock. Also, I just wanted to mention the questions at mck.ca again, because Dr. Gauthier will be back on Friday answering some questions on COVID-19. And again, questions at mck.ca. And I think that's about it for now. I know we have a lot of stuff going on here, but hopefully we've given you a little bit of good stuff at the end of today's report, just to help ease the burden of all of us having to get through this very difficult time. So on behalf of everybody here, we'd like to say thanks for being with us, and we'll see you tomorrow. Go adano, onigiwai.